Hi everyone, welcome back to the channel. In today's video, we will discuss about most repeated HCPCS coding for CPC exam. If you find this helpful, don't forget to subscribe, like and share. So let's begin. First question. A patient was hit from behind by another car while in her car and being fitted for foam cervical collar that is off the shelf. Which HCPCS level 2 code is reported? Option A L0120, B L0112, C L0170, D L0140. First notice the keywords in the question. In here, foam cervical collar and off the shelf. These words help us narrow down the correct code. So let's analyze each options. A L0120, cervical flexible, non-adjustable, prefabricated, off the shelf. Notice how this matches the keywords foam, off the shelf, cervical collar, same as the question. This is a strong indicator that this is the correct answer. Analyze other options to avoid mistake. L0112, cranial cervical orthosis, congenital torticollis type, with or without soft interface material, adjustable range of motion, joint custom fabricated. This is wrong answer because there is no keywords in the option. L0170, cervical collar molded to patient model. This is also wrong answer. L0140, cervical semi-rigid adjustable. It is also wrong answer. So the correct answer is option A. Next question. A wheelchair-bound resident of skilled nursing facility is seen in the physician office. The physician office makes arrangement with a social worker to take the patient back to the skilled nursing facility. What is HCPCS level? Transportation service code. Options A A0130, B A0120, C A0160, D A0100. So let's analyze each option. A0130, non-emergency transportation, wheelchair van. This is the correct answer because it is a wheelchair van and non-emergency transportation. So this is the correct answer. We can also check other options to avoid mistakes. A01204, minibus mountain area transport. It is wrong. And A01604, social worker or male case worker. A01004, transportation taxi. So here our question is wheelchair van, non-emergency. So the correct answer is option A, A0130. Next question. What is the HCPCS level 2 code for a long arm fiberglass cast for a 24-year-old patient? A. Q4012, B. Q4006, C. Q4008, D. Q4005. Let's analyze each option. A. Q4012, cast supplies, short arm cast, pediatric 0 to 10 year fiberglass. This is wrong because our question age is 24-year-old patient. So this is wrong answer. Option B, Q4006, cast supply, long arm cast, adult, 11 years plus, fiberglass. So this is the correct answer, 11 plus years, adult. So this is the correct. In option C, Q4008, cast supply, long arm cast, pediatric fiberglass. It is wrong because in our question 24-year-old. Check the age correct. Then Q4005, cast supplies, long arm cast, adult, 11 years plus plaster. Here plaster, in our question fiberglass. So this is also wrong. The correct answer is B. Next question. A physician provides 2 hours of mental health crisis intervention for a patient who has been unable to cope with the death of her twin sister. What HCPCS level 2 code is reported? Option A S9485, B S9485 into 2, C S9484, D S9484 into 2. Let's analyze each option. S9485 crisis intervention mental health service per day. But in our question, physician provides 2 hours of mental health crisis. So we can easily eliminate A and B option. Then we have C and D. S9484 crisis intervention mental health service per hour. So here 2 hours of mental health. So 2 units. So the correct answer is option D, S9484 into 2. Always check the unit of service whether the code is per hour, per session or per day. Okay. Next question. A patient presents to the office for an injection to the office for a ceftriaxone sodium for a UTI. The nurse reviews the physician's order and administers 250 mg of ceftriaxone sodium. The route of administration is IM. Options A 96365 J0698 into 250, B 96372 J0696, C 96372 J0695 into 5, D 90473 J0696. Here in this scenario, patient receives ceftriaxone sodium 250 mg for a UTI, route intramuscular, administration in the office setting by a nurse. First, identify the correct CPT codes. 96365 intravenous infusion, initial up to 1 hour. It is IV, but in our question it clearly says the route of administration is IM, which means intramuscular. So the option A is wrong. Then 96372 therapeutic, prophylactic or diagnosis infection, specify substance, subcutaneous or intramuscular. Here it is intramuscular. So B or C is the correct answer. And option D is immunization administration. Not relevant here in this question. Okay, so we can clearly eliminate option A and D. Then we have B and C. Now identify the correct HCPCS code. J0696 is ceftriaxone sodium 250 mg and J0695 is ceftriaxone sodium 1 gram. Since patient received 250 mg, the correct J code is J0696. No need to multiply into 5. So the correct option is option B 96372 J0696.